I am an RN. I'm also certified in hospice and palliative care. I am the case manager currently for the Medicare Care Choices model. It's for patients who are hospice eligible but still seeking aggressive treatments.
When you're a hospice nurse, it's about quality of life. And you want to give patients and families and help them through whatever time they have left and give them whatever quality they can.
The team that I work with is very supportive. And team being fellow nurses, social work, pastoral care, supervisors, from everyone, home health aides, everyone supports each other and works well together. Myrna's mom was enrolled in our program, the MCCM. She was our second enrollee in the program. 95-year-old woman who was still working at the time that we enrolled her in her real estate business, which I was so impressed with. I'm like, 95 and she's still working, amazing. She was diagnosed with terminal melanoma. It had metastasized to many parts of her body.
And she was being treated through one of the city hospitals, and she was getting some immunotherapy and had come onto the program, but then wasn't doing very well with the immunotherapy.
She was taken to the hospital, Englewood Hospital, and she wasn't improving at all. She was then transferred to a local nursing facility.
And the daughter had my name and phone number from when she was on the Medicare Care Choice program, and she called and had reached out.
And wanted help to decide, how do we go about, do we transition at this point to standard hospice services? They're struggling to make that decision.
And so we met for probably 3 or 4 hours to go through everybody in the room and talk about, this is really what's happening. You know, she's really starting to transition, and what is it that your mom would have wanted to do?
So we went home. She wanted to die in her own home, in her own bed. And Noreen introduced us to a gal, Lady Dawn. Dawn is the lady who sat with me when my mother was dying. We all know everybody dies, but what do? You talk about God, you talk about death, you talk about spirituality, and here was this amazing woman sharing this most intimate moment, who was compassionate, who understood where I was. There's no religious barriers. And I will always be grateful to the VNA for being the most remarkable angels on earth. I think they are doing God's work compassionately, and that I was blessed to meet them. And when Noreen called me and said, would I be interviewed, I was like, Noreen, I will do anything you ever ask me to do. You were so kind and wonderful to my mother, to me, and to our family.
And I keep thinking of Myrna and her husband and her children, and they're such a wonderful family, and it was such a testament to her mom. I said before, it's bittersweet, but you have that reward that you're able to have people move on comfortably. As much as you try to separate yourself or guard yourself, not be touched, there's those patients and families that really hit you. It's end of life, so you get close real fast sometimes.